Hernias are the abnormal protrusion of contents from a closed cavity. The closed cavity is one of the example is abdominal cavity. This is covered by the muscle layer. So, when there is a weakness of this muscle layer, the contents from the abdominal cavity protrude out. So, this is called as hernia. Inguinal hernia is otherwise called as groin hernia. This is the commonest hernia from the abdominal cavity. Groin hernias occur because of weakness in the muscles in the groin region. So, it can be congenital, or congenital means it happens when the child is growing, the muscles are weak, or it can happen in the adulthood because of weakness of the muscles in the groin. So, inguinal hernias can be bilateral or unilateral. Abdominal cavity can have different types of hernias, the commonest being groin hernia, otherwise called as inguinal hernia. The other type is where there is belly button protrusion, which is called as umbilical hernia because of the defect in the umbilicus. The third commonest is incisional hernia. Because of previous operation, the incision becomes weak and the contents protrude out. There are other rare hernias which are not so common. These are the three main hernias we see in the abdominal cavity. Inguinal hernias can be asymptomatic. Asymptomatic means you are unaware of it. So, most of the time it comes as a bulge in the groin, which becomes more prominent when you stand up, when you strain or cough, you see a bulge just above the scrotum. This is the initial stage of inguinal hernia. Many a time the patient also can complain of pain. More than the bulge, they can come with the pain. The pain occurs because of stretching of the muscles. The later symptoms are either the vomiting or it is too much pain in the abdomen. It occurs because of obstruction of the intestines in a large hernia. These are the symptoms. You can diagnose hernia by standing in front of the mirror and seeing the groin area to see whether there is any bulge, which disappears when lying down, which becomes more prominent on standing or coughing. This is how we diagnose hernia. No doubt, if you are not able to see the bulge and if you still have pain, we can do ultrasound to diagnose inguinal hernia in the initial stages. Inguinal hernias, there is no medical treatment. The medical treatment is just a painkiller to relieve the pain. The bulge has to be repaired by surgery. The surgery can be a open surgery or laparoscopic surgery. In olden days, the patient was operated by a open surgery where you make a small incision in the groin area to repair the defect with the mesh or with the suture material. In recent days, more and more laparoscopic surgeries are being done to repair this inguinal hernia, where you put a telescope inside the abdominal cavity and long instruments through a small hole into the abdominal cavity and repair this hernia from inside using a mesh.